My name is Randy White, and I'm going to be demonstrating the administration of naloxone, which is otherwise known as Narcan. This is one of the new EMT skills, and we'll be demonstrating how to use that drug. The first thing to know is you want to make sure that you have an IV started, that the IV is patent, that there's no filtration or anything out into the skin. The second thing is why we're going to use the drug, and we want to make sure that we document why we've used the drug to begin with. This drug can be a very dangerous drug if you don't use it at the right circumstance. What we would like to see is this drug used only if there's respiratory compromise, because this drug can cause pretty severe withdrawals. It can even make your patient combative. And so in saying that, we want to make sure that we titrate the drug to our desired effect, which is basically where they're no longer having respiratory compromise. So some of the other equipment that you may want to use is a SaO2 monitor for your patient, and of course a stethoscope to check for breath sounds and to make sure that you do a good assessment on respirations. If the patient requires bag valve mask, and obviously supplement load tube. In saying that, after you decide that you're going to use the Narcan, we want to get a good set of vital signs, a baseline set of vital signs, and we also want to get a good history if that's available to us. And so making sure that we're suspecting some type of narcotic overdose and they have respiratory compromise, then is when we want to use this drug. The drug comes in several different ways. It comes in a multi-dose vial, and it also comes in a 2 milliliter ampule, such as this one. And it also comes in a Bristojet vial, like this one. And I'll be demonstrating just the ampule and the Bristojet vial. The first thing we want to know about the ampule is that it is the right medication, it is the right patient that we're giving it to, it is the right concentration, and this particular concentration is 2 milliliters, and there is 1 milligram per milliliter. It is the right color. The color should be clear, and it is the right expiration date to make sure that we are within the expiration date. So after you've made sure that all of those things are complete, and making sure that the IV, our right route, is complete and patent, then you can open the vial and take the medication out. When you talk about ampules basically are scored at the neck of the ampule right here, okay? And then what you want to do is you want to click that scored piece and make sure that you get all the medication drawn up in the vial. But you can see that we have medication in the neck of the vial, and when I turn it over, the medication still stays there. There are 2 different ways that you can get that medication out. The first is just by tapping, and you can see now that there's no medication in that vial. The second is that when we have this like this, we can literally roll over the vial like this, and all the medication has gone down to the bottom. Again, we want to make sure that we have our full 2 milliliters in this part of the vial. After we accomplish that, we want to make sure that we choose the correct syringe. There are 2 milliliters in this, so I've chosen a 3 milliliter syringe with a pretty long needle on it so that I can reach the entire section. I want to make sure that the syringe is long enough so that I can take all the medication out. Now, because we're dealing with glass, we want to make sure that we protect ourselves, and the way that we protect ourselves is I'll take an alcohol prep and I'll basically put on this part, and I'll take another alcohol prep. We're going to make sure that we get all the medication down at the bottom of the vial. Okay, then I'll take another alcohol prep at the top of the vial like this, and then I will push it away from me and snap the vial. Once the vial is snapped, you'll note that because of it being a fluid in a tiny space, that we can turn the vial over and actually nothing come out unless we shake it. So we're not going to shake that. We're going to bring that back over. We're going to take the syringe and needle. Okay. Now what we want to do is we want to make sure that we're not putting our hands in danger when we start talking about taking medication from this vial. So now I'm going to lay the vial down, and then I'm going to penetrate the vial. I'm going to bring it up, and I'm going to twist it downward, and I'm going to start drawing the medication in. Now what I'm being careful of is I'm being careful that I am only drawing medication, because if you stick the needle in too far, you can actually draw only air. But as you can see, I drew the medication out, okay? And now I have a full 2 cc's of medication in my syringe. The next thing I want to do is I want to make sure that there's no air in my syringe. And then I'm not going to recap my needle. We don't recap needles. I'm going to actually take the needle and twist it and put it into the sharps box. Now this particular IV set has a lure lock on it, and this is a lure lock syringe. But even though that's a lure lock syringe, the end of my syringe is still sterile, but I don't know where this has been. So I'm going to clean off the end of my lure lock, and then I'm going to place the syringe on my lure lock and twist so that it actually locks on. The next thing I want to do is I want to make sure that I stop all the flow that is coming out from my IV, which more likely than not is running at a TKO rate. And then I'm going to slowly push the medication in. More likely than not, your doctor's orders will actually say titrate to effect. And so I have 2 milligrams of Narcan in the vial, and I'm going to titrate that to effect. I'm going to watch for respirations. I'm going to watch for my patient condition, and I'm going to slowly titrate that in. Now I'll give half the medication, then I'll open it up, let it free flow into the patient, again making sure that I'm watching patient condition. If the patient needs the rest of the medication, I'll repeat that procedure. Then after I'm finished and my respirations are normal, I'm going to remove the lure lock, make sure of how much medication I've given, and then dispose of the medication. The medication, naloxone, also comes in a Bristojet along with a multi-dose vial. But I have the Bristojet with me, and so I'm going to demonstrate the Bristojet. In the Bristojet, we'll open the box, and you'll have actually a 2-part syringe. One is the syringe. This particular syringe has a lure lock on it, and it is capped at both sides, so the inside is sterile. And the other is the medication itself. Now what we want to do is we want to pop the cap on the syringe and pop the cap on the medication. Then we're going to push the medication in and twist. And once we have twisted as far as it will go, we're going to pull the medication up. I'm going to take off the cap. Then I'm going to actually push what air there is in the medication out, like such. Then I'm going to take an alcohol prep, clean off the end of the lure lock, press it into, twist, and then much in the same fashion as we did on the ampule, we're going to titrate the medication to the effect on our patient. We're going to clamp off, And you not only can clamp off, but if you would prefer, you can pinch off the IV solution, and then that way it'll be easier to run solution in after you've given half a cc. We're going to give half a cc, run medication in, give another half a cc, run the medication in, and again we're going to titrate that to the effect of the respirations of our patient.